Okay, this is a presentation about Aidet, specifically what it is and how it can help us in the clinical environment. But before we get started on that, just some real quick history. Beginning in the fiscal year of 2014, the Centers for Medicare and Medicaid Services, or also called CMS, they determined that they would base some of their payments upon patient satisfaction scores. And so out of that, in response to that, Aidet came about in part from a healthcare consulting group called the Struder Group. I can't spell right now. The Struder Group. Okay? And what they determined was that they needed a way to consistently facilitate patients moving through the department. And specifically, Aidet is what came out of that decision-making process. Okay, so what the heck is Aidet? It's an acronym for Acknowledge, Introduce, Duration, Explain, and Thank. And this is a tool, just a really quick and easy way to remember various steps that we need to accomplish to help the patient through procedures. It's going to reduce patient resistance, it's going to improve compliance from the patient, it's going to help with patient and family anxiety, and increase the patient satisfaction, reduce or eliminate some of the complaints that patients have about healthcare. So the goal of the A is to establish trust by showing empathy. So we want to acknowledge the patient. Radiologic technologists need to make sure that the procedure room is ready before we even go to get the patient. Okay? Having a messy room gives the perception that the department lacks credibility. When we first acknowledge the patients, it's best if we smile and greet them by name. This is a warm and accepting acknowledgement, and it puts the patient at ease. Technologists need to make certain that we acknowledge any kind of fear, pain, discomfort, etc. So it's important for us to acknowledge how the patient's feeling. This shows the patient that we really care about their well-being. So it's important for us also to acknowledge the family's concerns. Even though in the healthcare environment the family's concerns don't necessarily pertain to like the chest x-ray that I'm doing, I still need to acknowledge that because they influence how the patient is feeling. So families are just as important as the patients, since many times families influence the patient's perceptions of what's going on. So here's some examples of things that we might say. Like for example, if the patient needs to change their clothes, I would encourage you to say, I'm pulling the curtain for your privacy. Acknowledge that they have needs of privacy. So for your safety now, I'm checking your armband. Acknowledge that they're a human being and that you have professionalism, you are doing your job. Ask them questions like, can I get you a wheelchair if they seem to be having a difficult time? Are you cold? Can I get you a blanket? All of these are ways that we can acknowledge the patient and how they're feeling. Introduce. The goal here is to reduce patient anxiety by sharing the skill set of yourself and anyone else who may be caring for them. So it's important that we manage ourselves up, quote unquote, to create patient confidence and trust. Patients have a right to know the competency of those who are going to be working with them, right? So I know we're students right now, but as you introduce yourself, say your name, your role, your skill set, and your experience. So for example, for myself, I would say, hey, my name's Benny Roberts. I'm a CT technologist, or I'm an X-ray technologist. I've been doing this kind of work for about 10 years, board certified through the ART. I'm really great to be taking care of you today. That's just an example, a really bad example. But it's imperative that you manage up the patient, not only their perceptions of you, but also your coworkers, your fellow students, the clinical preceptors, and other departments within the healthcare facility that you're working. So an example of managing up your coworkers is Mrs. Johnson, I'm going to take you back to the emergency room. Your nurse, Amy, will take excellent care of you. She's been a nurse here for many years. I hear such nice compliments from her patients, right? Managing up other departments. Mrs. Johnson, I'm going to take you back to the emergency room. They're going to take great care of you. The staff is very courteous and friendly. You're in good hands. Managing up the physicians. This is absolutely critical. I mean, I'm not going to ask you to lie or anything, but find quality things to say about everyone you work with. So, example, hello, Mrs. Johnson. Dr. Smith will be here to assist in this biopsy. Dr. Smith is an excellent physician. I've worked with him for 3 years. He's great with his patients. He'll explain everything really well. You're in good hands. Now, I know you've not been working at this for 3 years, right? There are ways to talk about this that are appropriate. I'm really excited to be working with you. I'm a student. I've been studying this stuff for like 2 years, and I'm now preparing to be board certified. Right? So that's how to introduce. Duration. The goal of duration is to reduce anxiety by establishing time expectations. Okay? Patients need to know the wait time for their exams, the duration of the exams, their report turnaround times. If patients have to wait for an extended period of time, the radiology personnel need to be proactive and inform them of the wait to decrease their anxiety levels. This is also really, really critical because it can help us prevent people, quote-unquote, falling through the cracks, right? Like I worked at a hospital, I did some graveyard shifts there, and I would take back ER patients. I always made sure to tell them, hey, look, we're going to have a report from the radiologist in 20 or 30 minutes. We're really consistent on that. We always have a report from these ER studies in 20 or 30 minutes. So if you haven't heard something from Dr. Smith or whoever, after 20 or 30 minutes, maybe push your call light and ask them, have they gotten the CT report, and make sure that everything is flowing there appropriately. This really, really, really helps the patients because it empowers them to make decisions about their own health care. Anytime we can give a person a chance to make a decision about their own health care, we are winning their trust that much more by empowering them with choices. Okay, so the primary goal of the explanation stage is to enlist the patient in the level of their care. Okay, all patients have a right to know what's going to happen during this procedure, and that's why that's why we need to explain the entire process. So why are we doing the exam? Why we need to start an IV, etc. We need to explain the procedure in a way the patient and the family understand, right? So no fancy medical terms are needed. To maintain patient confidentiality, we also need to explain the procedure in the room, not in the hallway where others can hear, right? This is a really critical part of the process because it allows us to kind of do our job in terms of maintaining radiation safety practices. So, for instance, before I do a chest x-ray, I'll explain to them, I'm going to be doing an x-ray of your chest. There'll be 2 views. It'll probably take me about 15 minutes. And I'll ask the patient, what kind of problems are you having today, so I can get a little bit of history. If they say, well, actually, my chest doesn't hurt at all, I'm having some wrist pain, then that might be a time to hit the pause button and try to make sure that we have the right exam ordered for the right patient. This is especially critical when we're doing anything that is a more high-dose procedure like a fluoro exam or CT. Some examples of phrases we can use to help the explanation process along is before we get started, maybe saying, do you have any questions before we start? Or let me explain the test to you. This is how it works. You'll stand up next to the board, take a few breaths in, I'll take some pictures, make sure you hold still. That's really critical. If you move while we're doing the exam, we may have to repeat an image, and that's we want to avoid that if possible. Another thing we might say is, is there anything I can do? Is there anything that I've said so far that you don't understand? Like, is all this making sense to you? Finally, the goal of the thanking stage, this final stage, is to build loyalty and leave a lasting impression with the patient. We want to convince them that we really enjoyed meeting them. And I'm reminded of the fellow that seats people down at the rendezvous. I'm a vegetarian, but when I really want to go and celebrate, I go and have some barbecue at the rendezvous. And in part because the fellow that seats you in the table, he's been working there for 20 years. I think his name's Robert or something like that. He told me once, every day I come to work, I see something new. And I feel like we really have that opportunity in the hospital to say that. Every day we come to work, we have an opportunity to learn something new. Every person that we meet, I feel like, has been specifically put in our heart, in our lives, to teach us something. So thanking them, showing gratitude for that learning process is a profound thing. It's life-changing. So this stage is basically, it gives us a chance for the patient and the technologist to share any concerns about the procedure. So as we thank them, a lot of times patients might then ask, well, that seemed weird, or why did we do that? So it's one last chance to make sure that we did the right thing. It's really important that we not give some kind of generic thanks when we're finished with the patient's exam. Remember, this may be like the 500th chest x-ray that you've done, but it may be this patient's very first chest x-ray, right? This is especially true with like pediatric patients or with the elderly. This may be some of the only human interaction that our elderly patients get. So don't come up with some generic thank you. Really specifically look for qualities to be grateful for in that individual. And so thank the patient for something specifically. For example, thank the patient for their cooperation, for waiting, for understanding, for being so funny, for being so kind. Thank you for choosing our healthcare facility. I know that was a difficult test. You did really great. Thank you so much for bearing with us. I know that wasn't really fun getting an IV, but you're real tough, and that helped us get better pictures. So thank you so much. Thank you for letting us take care of you. So the benefits related to Aidet, again, are decreasing the patient anxiety, improving clinical outcomes, increased patient compliance, increased patient satisfaction, and then accountability and reproducibility. Sometimes it's just, now it's important to acknowledge that no published scholarly articles have been found to date, at least I couldn't find any when I did my research for this, that verify an Aidet program is kind of widely successful at improving patient satisfaction scores. But while that's true, at the same time, if we can establish algorithms, right, or recipes for doing what we do, especially since we're working around ionizing radiation, having these recipes in place can help us be that much more safe and consistent in the way that we're applying ionizing radiation. So having something simple like Aidet, acknowledge, introduce, duration, explain, thank, in place allows me to just go down the checklist mentally, and I am going to, in the Aidet process, ensure patient compliance, make sure they're not going to move during the exam, and then also make sure I'm doing the right exam on the right person for the right reasons. So some other helpful hints that might just kind of get you thinking, and I'd love to hear your thoughts too and ideas about how Aidet might work for you, or how it might not work, things that might not work about this. But things that I think about in terms of the way I want myself to be represented to patients in terms of my ethics and my idea of professional, my own personal integrity, is it's helpful to walk toward the patient when we greet them. So when we call the patient in the waiting room, take a few steps toward the patient, right? Don't just stand there by the door. I know that maybe you have to badge back through the door or whatever, but it's worth it to make that first impression meaningful. Never walk ahead of the patient down the hallway. Walk next to the patient and offer, directions for the way to go. Always engage in some sort of conversation with the patient on the way to the exam room. How are you doing? What's the weather like out there? How about those New York Yankees or whatever? I don't know. Anytime we're addressing the patient, it's absolutely critical to get on the same level as the patient and make eye contact. Now, certain cultures, eye contact is not appropriate. But I would say predominantly in America and in the American culture, if we're dodgy with our eyes, that's perceived as mistrustful, right? So these kyphotic patients, the little ladies who are hunched over in the wheelchair, get down on your knees, look up into their eyes, let them feel that trust that comes from eye contact. And then physically walk the patient out of the department. Don't just say, hey, the exit's to the right and the left. Take them out. Use that as the time to thank them, to acknowledge how important it was that you really enjoyed getting to know them. So the perceptions are the big part of this. The benefits of a tool like Aidet, I mentioned, is that it gives us an algorithm for moving through workflow, but from the patient's point of view, it's designed to leave nothing open for interpretation. There's no question marks over their head about any part of this process. So it's going to align with the patient's perceptions and further align the patient's perceptions with those of the healthcare team, right? The entire healthcare team. That's part of how Managing Up works. So I mentioned that there's no published scholarly articles out there verifying that an Aidet program is widely successful, but I did find this this information that by implementing Aidet, patient satisfaction scores rose by 2.4% for Whitman Memorial Hospital. I think this is in Indiana. So after the administration saw this jump in imaging patient satisfaction scores, they adopted Aidet throughout the entire facility, and it has become a fairly widespread thing. Every facility that I've worked at in the past 5 years has encouraged the use of Aidet. And here is some of my references, or my one reference for this presentation. Thank you so much. This has been great.